If you want the benefits of GLP-1 medications but are scared of nausea and vomiting, Eden's microdosing approach is designed to make treatment easier to tolerate. In this video, we will break down what microdosing is, how it works at Eden, and who it is best for. Microdosing GLP-1s means starting at doses lower than the usual starting dose and increasing more gradually over time. Instead of jumping straight to 0.25 milligrams of semaglutide once a week, a microdosing schedule might start as low as 0.05 to 0.1 milligrams weekly, then increase in small steps like 0.15, 0.2, and 0.25 milligrams, with changes every 1 to 2 weeks based on how you feel. You still work toward a therapeutic dose, but you give your body more time to adjust at each step, which can dramatically reduce side effects. Standard titration for drugs like Wegovy and Ozempic often doubles the dose every month. Clinical trials following that schedule reported high rates of stomach issues. Around 44% of people had nausea, 24% had vomiting, 30% had diarrhea, and 24% had constipation. In the real world, where monitoring is looser and people have more varied health histories, those side effects can feel even worse and lead 10 to 20% of patients to quit in the first 2 to 3 months. Studies of ultra-low starting doses, such as around 0.0675 milligrams instead of 0.25 milligrams, show far fewer people stopping because of side effects, while achieving similar weight loss over 6 months. Eden is set up to support this low and slow titration strategy in a few key ways. First, they use compounded semaglutide and tirzepatide in multi-dose vials instead of fixed-dose pens, so your provider can prescribe very small, customized doses like 0.05, 0.1, or 0.15 milligrams and adjust them in fine increments. Second, Eden ships extra needles, syringes, and supplies, which makes it practical to microdose and tweak doses without running out of equipment. Third, their clinicians are comfortable building custom titration plans instead of forcing everyone into the standard FDA schedule, and their flat pricing means your monthly cost does not jump when your dose increases. The goal is not to stay on tiny doses forever, but to reach the dose that controls your appetite with side effects you can live with, even if that takes a few extra months. Microdosing is especially helpful if you have a sensitive stomach, a history of IBS or GERD, have had bad side effects in the past, or feel anxious about nausea. It can also be a good fit if you care a lot about preserving muscle and want slower, steadier weight loss. On the other hand, if you need very rapid blood sugar control, have tolerated GLP-1s well before on standard schedules, or prefer a set-it-and-forget-it approach, a conventional titration might still make more sense. Even with microdosing, some people will still feel mild side effects, especially in the first 24 to 48 hours after an injection or dose increase. Simple steps like injecting on a weekend, eating smaller low-fat meals, sipping fluids through the day, and using ginger or vitamin B6 with your provider's approval can make a big difference. The advantage with Eden is that if a new dose feels like too much, you can message your provider and simply step back down to a lower dose instead of suffering through it. If you want a detailed breakdown of sample Eden microdosing schedules, who is most likely to benefit, and how this approach compares to other GLP-1 programs, read the full Eden GLP-1 microdosing guide on the GLP-1 guide linked in the description. If this video helped you understand how microdosing can make GLP-1s more tolerable, please like the video, subscribe for more honest GLP-1 education and program reviews, and visit the glp1guide.com through the link in the description to keep learning and compare trusted GLP-1 options side by side.